called into management for lack of hand hygiene. Can you believe it?
Oh, well, let's go sit down and talk about it.
Alright.
Come on over here, so tell me what happened.
Well, I mean, I always have clean hands, and they said I just don't wash my hands enough. Like, if I don't have gloves on, then of course I'll wash my hands, but if I wear gloves, what's the point?
Well, your hands can still become contaminated even if you're wearing gloves. They never taught you this?
No.
Okay, and you should be washing your hands before and after any patient contact. It's very important to prevent spread of infection between patients.
I guess so, but I have nothing to spread. I'm not sick.
What do you know about hospital-acquired infections?
What's that?
Oh boy, okay. So when patients are hospitalized, it's possible for their caregivers to spread infection between them. The number one way to prevent this is hand hygiene. Washing your hands, or do you use the gels, the sanitizer gels?
I don't really believe in the gel.
They're proven to be just as effective as soap and water as long as your hands are not visibly soiled or the patient doesn't have C. diff. The gel is just as effective. It takes 20 seconds compared to 1 full minute to actually wash your hands with soap and water. So that is something that that you really need to keep in mind.
Well, how come I have to wash my hands when I touch patients, but when I use my stethoscope to take blood pressures, they touch patients too.
Your stethoscope you should be washing it, cleaning it with an alcohol swab between patients. In a recent study that was done, it was found that 89% of healthcare provider stethoscopes carried Staph aureus. Once it was simply cleaned with an alcohol wipe, that reduced the microbe count by 94%, which greatly reduces the chance of the spread of infection.
Wow. Speaking of staph, isn't that like the SARS infection? What was that about?
Nope. SARS a few years ago was airborne, which with airborne precautions, we have to be extra diligent. It requires a negative air pressure room where the patient is. They have to be isolated. Any person going into the room needs to wear an N95 respirator mask, as well as gown, gloves. And the important thing with any type of contact precautions is putting it on before entering the room, taking it off properly as to not contaminate yourself when you're coming out of the room. There are also contact precautions, which involve gloves, possibly gowns. Any part that's touching the patient needs to be protected with some type of barrier. There are actually also droplet precautions, which we're entering flu season now. Anybody going in should wear gloves and a mask.
So we should always have our flu shot too?
Yes, we definitely should have our flu shot. That's very important with infection prevention. And now actually all nurses, anybody in healthcare is required to have it every year. And if you don't wear it, you are required to wear a mask at all times whenever you're having patient contact.
I think I'm starting to understand.
Good. I can't believe this was not taught on orientation. We really should be teaching the importance of hand washing, number one, the spread of infection, number two, and preventing this upon hire, and we should be having yearly training on this as refreshers for people. I'm really going to have a long talk with our infection control nurse and find out what is going on with all this, because we need more education on this.
Yeah, why was I never taught this?
You should have been. We're going to have to work that out with infection control and create a program to make sure that we don't run into this scenario again. We need to understand that we are the first line of defense for spreading infection from patients to patients.
Gotcha.
Okay.
All right. I'm so glad we had this talk.
Me too.
Now I can take better care of my patients.
Yes. Remember, hand washing, number one.
All right. Thank you.
You're welcome.
I'll start by washing my hands now.